A lot of patients suffer from chronic back pain, and this pain may be just because of facet joint effusion or facet joint pain syndrome. So this is normally seen between the age of 40 to 70 years when the spine starts getting aged and there is arthritis of the joints. So come, let's understand in this model how it seems like and how to treat it. How our spine or a human spine model looks like. We have discs here at the front, and then we have bone, and at the back of the human spine we have joints like this. So this is a typical facet joint on the human spine. So whenever we do a movement, that movement occurs here at this part of the joint. So with age, what happens? Arthritis of this joint starts, and whenever there is arthritis, this surface becomes rough. So whenever the person tries to move, say bend forward or lean backwards, this movement which occurs at this joint becomes painful. So because this joint becomes painful, there is a sudden catch in the back and the movement becomes very painful. So now for this, it is important that we treat this condition, otherwise the patient might develop a chronic back pain. So we have three treatment modalities for this. First is the person should try to reduce weight on these joints, that is by reducing his body weight. Second, he should do regular back strengthening exercises so that the muscles around these joints help in putting the load of these joints. Thirdly, your doctor might give you some anti-inflammatory or some cartilage preserving medicines so that these joints become more efficient and the inflammation goes down. Next is, if nothing seems to be helping and your MRI or CT scan is confirming that there is facet joint effusion or facet joint pain, then you might require a minimally invasive procedure in the form of facet joint injection or radiofrequency ablation for this facet joint pain syndrome. Now this can happen in the lower part of the spine, which is the lumbar spine, or it can happen in the upper part of the spine also. Depending on the location, the technique of giving this facet joint injection is different, but it is normally a 10 to 15 minutes procedure done under local anesthesia in operation theatre setting, where the patient has to lie down on his back for around 10 minutes and this procedure is done. If this facet joint injection is helpful and the patient is able to get back to normal activities, then we might consider doing a radiofrequency ablation, in which the nerve supply to this joint, which normally runs through this part of the bone, we selectively ablate or burn that part of the nerve, and the pain arising from this joint then does not travel back to the brain. So this is a safe and effective procedure for patients who are having severe back pain because of facet joint syndrome. But if you are suffering from facet joint pain syndrome, first you should see your doctor, who will get your X-ray or MRI done. He will start you on conservative treatment by asking you to reduce weight, do exercises, or he might give you few anti-inflammatory medicines for a few weeks. If nothing seems to be helping, then only facet joint injection or radiofrequency ablation procedure is required. Thank you.